I couldn't see very good at all through my right eye. It was very cloudy, smoky-like, and I didn't know where I was going to find a good doctor. My eye was just fantastic. This is one fabulous doctor. I could never say enough about him, truly.
I'd like to welcome Laguna Woods to my office. We help our patients maximize their vision and live their lives to the fullest.
The Orange County Eye Institute is a comprehensive eye care center. See well, live well.
Welcome back as we continue on with our program for today, and Dr. Salib back with us today to talk a bit about our eyes, and specifically something that seems to impact us maybe more so here in California than other places, and that's dry eye disease. We all know what it feels like when our eyes are itchy and scratchy, but is there a medical definition of dry eye as a disease?
Sure. Dry eye disease is basically a disorder of the tear film that coats our eyes that is usually inadequate, and that leads to drying of the eyes as well as ocular surface damage or damage to the front of the eye. The tear film is very important for many hosts of functions, including lubrication of the eyes, obviously, and that will help to improve the clarity of your vision and the sharpness of your vision, but also to protect the eyes from any things that might get in the eyes, like dust or dirt or even pollens. And it also helps prevent scratches of the eyes. If your eyes are nice and lubricated, if something were to go inside your eye, it would better resist any types of scratches.
Okay. You know, classically, like I say, we sometimes just know our eyes are itchy and they feel bad. But is there a medical definition of symptoms that actually allow you to say, yes, you have dry eye disease?
Well, the thing about dry eye disease is that there are a whole host of symptoms. For instance, people will complain that their eyes just feel tired, or they might feel dry, or they might burn a lot. One common symptom that people don't even think to relate to dry eyes is watering eyes. If an eye waters, it means that the eye is dry because the eye gets irritated and will reflexively water to actually lubricate itself to prevent any further drying. So
that's actually a symptom that your eye is trying to compensate for the dryness out there.
Yeah, exactly.
How common is dry eye disease?
It's actually very common. In fact, about 40 to 50% of all visits to the eye care doctor include symptoms for dry eye disease. One study in 2005, a Gallup poll, suggested that almost 93 million people in this country alone suffer from dry eye disease. So it's very common, actually.
Is there any demographics, men versus women, older versus younger, ethnic situations, or where people live? Are these factors at all?
Certainly, all of those things can have an impact on whether you have dry eye disease or not. For instance, the older you are, of course, your glands don't produce the tears quite as well. Things get blocked in terms of the oil production for your eyes to lubricate it. So age does have a factor. Hormones have a factor, including menopause. If you lose some of the hormones or have a decrease of some of those hormones, certain aspects of the tear film won't be produced. Environmental factors like the Santa Ana winds can often cause drying of the eyes, and even certain medications can do it. Certain blood pressure medications, antihistamines for allergies can do it. A whole host of different things can do it. Even sometimes where we live, the arid environment that we live in can impact whether we have dry eye disease or not.
But I guess the factors being what they are, you could have it in Minnesota or the Great Lakes.
Yeah, you sure can, yes. In fact, most people do have dry eye disease wherever they live, you know, because the medications they take, their age. Some autoimmune diseases, such as Sjogren's disease, which is the disease of dry eyes and dry mouth, and arthritis can cause that, like rheumatoid arthritis, and other things like lupus or thyroid disease. So we have all of those problems all over the country, and certain medications we take.
Right, right. So let's talk about the treatment. I mean, there's lots of things over the counter. If you go in any pharmacy, there's a whole area of eye care products. We're seeing them advertised on television, and they say, use this one, no, use this one. It gets the red out, it does this, it does that. Some are prescriptions, some are over the counter. What's the treatment? Somebody comes in to see you, what do you recommend?
Right. Well, I usually first try to figure out what is causing the dry eye disease, if it's an eyelid problem or if it's an actual just drying problem or production problem. The most common treatment is lubricating the eye with some artificial tears. And then, for instance, if their eyelids are a problem, if they're not producing enough oils to lubricate the eyes, I'll have them do some warm compresses of the eyelids. A prescription medication such as Restasis is also very effective in increasing the production of your tears. Omega-3 fatty acids such as the fish oils, flaxseed oil can also be quite helpful. Or some just things that you can change around the house, such as putting a humidifier in your room, or wearing sunglasses when you're outside, or eyeglasses can block the wind and decrease sun damage. So,
What about pets? Do sometimes people, I know there's allergies to pets, can that lead to dry eye?
well, certainly the more exposure to pollens and dander that you might have from these animals or plants can cause allergies, which will cause you to take some antihistamines, which can cause quite a drying effect. So again, the medications can do that.
So it sounds like good common sense is one of the best preventatives. You know, a good diet, you mentioned the omega-3. Most doctors recommend that for those of us over 50. It helps with heart health and some of those things. It also helps with eye health, you said.
Right.
And of course, I guess, is drinking enough water, do people become dehydrated? Could that lead to it as well?
Oh, sure, yes. If you're not drinking adequately, the amount of fluids you should per day, and if the medications you're taking are causing you, for instance, to lose water, then you certainly can become dry because of that. Yes, it affects the whole body.
Right. And we're coming up on the springtime of the year, moving into the summer. Spring, all these nice new plants are growing up and all these flowers, so we'll be having that assault from plant input and the warmer weather and the heat. And you mentioned sunglasses. I know you recommend that for lots of good reasons for our eye health.
Sure.
But that's very important as well.
Oh, of course, yes. Sunglasses are important to prevent the sun damage. Sometimes you can get growths on your eye that will further cause drying of the eyes just because of the sun. So that will definitely help you.
When someone comes in for a regular eye exam, I'm assuming that's one of the things you look for or ask about, but you can probably almost tell by looking in the eye if dry eye is a problem as well.
Oh, sure. At the microscope, when we put a special dye in your eyes to see if there are little sunspots actually that I can see on the corneas themselves. It's kind of like having a dirty windshield or a splotchy windshield. So I'll be able to see that. I'll be able to see how thick your tear film is and be able to advise you based on that.
You mentioned something like Restasis, which is a prescription product. What about the over-the-counter eye drops?
Sure, there's a lot of good lubricant drops out there. The ones that I like say that they get the dry out of the eyes, not the ones that say gets the red out of the eyes. Those red reliever drops tend to be quite irritating to the eyes after a lot of use. There's many different products out there, Refresh, Optive, Sustain. I like all of them. They're all pretty good. You don't have to get the brand name necessarily, but as long as it's just a lubricant and not gets the red out, I like that.
Is there ever a risk of using too much of those products?
Well, if you get the ones in a bottle, they have preservatives, so I would suggest using them about 4 times or less per day. Usually I suggest 2 to 4 times a day. If you feel that you need it more often, you should switch to something that's preservative-free, which they have those products over the counter as well, so that the preservatives themselves don't start to irritate your eyes.
So that's the one you have to put in the refrigerator?
Not necessarily, actually. Usually they come in little vials that you can break off that within 24 hours of use you can usually use them and then toss them. The preservatives keep them in the bottles, and you can keep those all outside of the fridge.
Right. Well, whatever your eye situation might be, Dr. Salib is there to take a look at your eyes and help you with your vision. Where would we find your office?
Oh, it's at the Saddleback Memorial Medical Tower, and the Laguna Woods bus does drop off there.
All right.
On the 3rd floor.
Orange County Eye Institute and Dr. George Salib, our guest today. Again, dry eye, something I guess we all have from time to time living here in the desert of Southern California.
That's right.
Good prevention and some good cures on the way as well. Thanks for joining us.
Thank you.
Good day on the program today. We'll continue on with more of what's going on here in the village right after this.
Dr. Salib did the lens replacement in my right eye. Since seeing Dr. Salib and having this procedure, I can now see my children's faces, my grandchildren's faces, and the clothes they're wearing much more clearly. I wasn't sure what to expect, but I see perfectly now.
We help our patients maximize their vision and live their lives to the fullest.
The Orange County Eye Institute is a comprehensive eye care center. We are specialists in cataract surgery, laser vision correction, dry eyes, glaucoma, and multifocal lens implants. See well, live well.